Hello guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today we will discuss about CO 256 denial code in medical billing. This denial CO 256 standing for services not payable as per managed care contract. So if we got this denial from the insurance companies, what kind of pre-call analysis we will do and what kind of questions we should have to ask over the phone call to the representative, and also what kind of end actions, what kind of action we would like to take on this CO 256 denial, we will discuss in this video. Before that, we should have to understand that what is managed care contract and what is participating provider. We have to understand the concept for this scenario. We will discuss in this video. Okay guys, now we are discussing about managed care contract. Before that, we have to understand that to understand CO 256 denial, the both concepts like participating provider and managed care contract concept is very important. So first we will discuss about managed care contract. Here, nothing but an health insurance plan that requires patients to consult a doctors and hospitals that have a contracted with the managed care company. So I would like to explain this point. Nothing but there are some kind of health plans like HMO, PPO, EPO, POS. That kind of plans are there, which are offered by a managed care companies. So managed care companies nothing but, for example, Cigna, Medicare Cigna, or Humana Medicare or Medicare Humana. These are the advantage plans, also known as a managed care companies. So these companies offers to the members like a HMO plan, EPO plan. That kind of plans are known as a managed care plans. So for example, patient have a HMO plan and he consulted a doctor and hospital to get a treatment. That is known as a contract with the managed care company, and also that kind of HMO plan have a some kind of specific limitations and exclusions for a covered services. Nothing but, for example, patient have a HMO plan. The exclusions and limitations are nothing but patient is should consult a primary care physician. Nothing but he should take a referral from the managed care company. And for example, patient has a PPO plan. At the time, the specific limitations and exclusions for that kind of patient plan is nothing but there is a no need to take a referral for the PPO network plans. So yeah, we have to understand that here, depending upon the patient plan, the managed care contract, the managed care contract rules and regulations will be changes. But for example, patient medical condition is related to emergency, for example accident and some other medical emergency. At the time of emergency, irrespective of managed care contract concept, the patient will go anywhere like in network or out of network health plans or hospitals or doctors, and you can that patient can take treatment from anywhere. There is a no restrictions. So nothing but there is a no PPO or HMO. This kind of plans will be not verified. There are no specific limitations and exclusions for the emergency services or urgent care services. So we have to understand that if there is a emergency, there is a no kind of managed care concepts will be come into the picture. Only for kind of HMO or PPO plans, at that time only managed care concept will be come into the picture. And the next one is participating provider, a doctor or hospital that agrees to accept your insurance payment for a covered services as payment in a full. So there are a little bit deductibles and copays and co-insurance. That is nothing but participating provider. Participating provider is nothing but doctor is agrees to accept insurance payments, your insurance payments for a covered services. Because as a member, as a patient, for example, you are a member or patient, you are giving the premium to the insurance companies and you are took services from the doctor because you taken a treatment as a patient from the doctor. Then your services will be paid to doctor, right? At the time before that, the doctor should agrees, to accept your insurance payment from the insurance companies for your treatment. That is nothing but participating provider. We have to understand these two concepts. Okay guys, now we are discussing about pre-call analysis for CO256 denial. See guys, for example, if you not received any claim status from the insurance, for example, a medical claim is submitted to insurance company and we didn't receive any response back from the insurance company. At the time, you should have to check all internal sources like your respective doctor's billing office, nothing but practice management system, nothing but your software, and you should have to check clearinghouse, nothing but whatever clearinghouse you are using. For example, you submitted electronic claims, right, through one kind of entity or software, that is nothing but clearinghouse, that is intermediate between your doctor and insurance. So you should have to check that clearinghouse for any EOB received or we got any status, like either it is entered to the payer adjudication system your claim, or otherwise it is already rejected from your clearinghouse. So you should have to verify your clearinghouse for the status, and also if you have access for your portals, and you should have to verify portal for a claim status. So that is your job. So for example, you submitted claim to insurance and you don't get any status, I mean you don't receive any EOB, then directly calling to insurance is not a good job. You should have to verify your PMS, clearinghouse and portals. For example, you does not found any claim information in these three kind of, I mean all kind of sources, then you should have to call to insurance for a claim status. And here the next point is, if already a denied EOB with a denied code CO256 is already posted in your PMS, then need to verify the previous DAS payment history and also other covered insurance details. Generally, you know what happened, CO256, for example, denial is there. Then previously you should have to verify we got any payments for this kind of services from the insurance company. For example, you have a payments, previous claims are got paid for the same doctor for same kind of services from the same kind of insurance, then we have to understand that we have to call to insurance. We should have to probe this information with the insurance representative over the phone call, and should reprocess the claim by stating the same information to the insurance representative. That is why pre-call analysis is very important. For example, there is no previous payments, this is only the first time, and there is no other insurance also there, then obviously you should have to follow up on a denial. But before that, pre-call analysis is very important. And third point, carefully examine all relevant health documents to ensure the necessary information. Why? Because this is very important, because your denial is telling that your managed care contract. So that kind of information, for example, you should have to verify patient policy, authorization details, participating provider documents, medical records details, and you should have to gather all supporting documents like physician notes to prove the medical necessity. For example, they are telling that it is a denied CO to 56 only, we will not give any payments, then you should have to tell to them that okay, we need payments for this kind of doctor because our services are related as per contract, so we want payments. At the time, what kind of proofs we have, for example, participating provider document we have, so at the time we should have to attach those participating provider documents to prove the medical necessity to get the payments from the insurance companies. Like that, we should have to verify as a pre-call analysis, does we have all relevant documents or necessary documents to prove the medical necessity to the insurance company. These are the pre-call analysis before calling to insurance company on this CO 256 scenario. Okay guys, now we are discussing about on-call steps for CO 256 denial. For example, you did not receive any response or any status from the insurance or any UOB, you did not receive any UOB from the insurance company, at the time you should have to ask over the phone call, like, may I know the claim status, please. For example, denied UOB already received from the insurance and was posted in a PMS doctor system with the denial code CO256. At the time, you should have to ask, may I know the denied clarification, please, or may I know the denied reason, please. At the time, insurance representative might tell that this drug or supply is not included in the fee schedule. So at the time, you should have to verify in your system that this kind of drug previously we got a payments from the insurance or not. For example, we got payments for the similar kind of procedure in previous dose or in future dose from the same insurance, and we got payments. At the time, you should have to prove that information over the phone call itself, and you should have to request the claim back for reprocess. If the claim sent for reprocess, they will provide the reprocess ticket number and a reprocess tat like 30 days or 40 business days. In that way, you should have to close the claim. Sometimes what happen, for example, claim is billed with ENM code and venipuncture codes. Claim is partially paid for ENM code and venipuncture procedures code, for example 36415, is denied as a service is not deemed or not payable according to the conditions outlined in a managed care contract. So they are telling that as per this contract, this kind of services are not payable. At that time, you should have to verify your client updates, or you should have to take your supervisor assistance, and you should also verify how this kind of venipuncture codes are closed on previous DOS. For example, if you are a build this is the first time, and then you should have to take a approval from your client to take what kind of action we should have to take. Directly we can go for adjustment, or otherwise we can take any review assistance is required on this kind of claims. So here what I'm telling is, some kind of services are not covered as per insurance, as per providers plans also, but here particularly this kind of particular CPTs or particular kind of services are not covered by the insurance. So at the time, what kind of actions we will take, accordingly we should have to verify that details. For example, sometimes this kind of claims go for appeal, so you should have to ask, may I know the claims appeals details, like appeals mailing address and a fax number with attention and appeals timely filing limit. In that way, you should have to get that required information over the phone call. For example, you don't have any UOB, for example, at the time you should have to take claim number and call reference number, you can close the claim. And I already provide that if previous or future DOS got payments for similar kind of services, whatever denied services, in that case you should have to probe and reprocess the claim. And that is that information is enough. For example, reprocessing, if you send claim back for reprocessing, you should have to take the TAT, turnaround time, for that reprocessing period. You can take the call reference number, you can close the claim. This is only the basic questions you need to ask for CO256 denial over the phone call. Okay guys, now we are discussing about CO256 denial end actions. So if we got CO256 denial from the insurance, what kind of corrective actions we should have to take over the claim? First point I given as a reprocess the claim. For example, we already discussed on previous slide that, for example, we got denied procedure. If we verified previous claims history, we got we got to know that previous DOS or future DOS we got a payments for the same kind of services, whatever right now it is denied, but previously it was paid. At the time, you can go for reprocess the claim. You should have to probe that information to the insurance representative, and you should have to reprocess the claim over the phone call itself. So in that way, scenario will go for reprocess. Nothing but if you got payments previously for the denied services right now, whatever denied procedures right now, they got already paid previously. Why this time it is denied? So we have to reprocess the claim for that kind of claims. Second point is appeal the claim. For example, complete claim is denied stating that this drug is not covered as per schedule provider fee schedule. At the time, uh, if you felt that the denial is incorrect, and if you felt that whatever our doctor given services is deemed necessity, or it is a correct, or it is a valid, at the time you should have to appeal that claim with your required documents like medical records. Sometimes they are telling that provider is not participated. If you have any participating provider documents with you, you should have to attach to your appeal to prove the medical necessity. So yeah, sometimes what happen, this kind of services are not approved because provider is out of network as per patient plan. So at that time you should have to prove them that okay, we already appealed with I mean we already submitted claim with a authorization number since it is a out of network. So could you please review our medical record, and at the time we should have to attach approved authorization letters. So here what I'm telling is, if you are going for appeal and insurance is telling that this drug is not covered, at the time you should have to prove why it will be uh, need to be covered by the insurance. So in that way you should have to attach required documents, example approved authorization letters and participating provider documents. So this kind of documents will make key role to process your appeal, because we have to understand that appeal is the final action on a claim to get a payments from the insurance. And the last point is adjust the claim. See, I already told that claim is partially paid. For example, this kind of scenarios, partially paid and partially denied. Example, venipuncture codes are denied and other CPT is paid. At the time, for example, already client is given update that this kind of small procedure codes, venipuncture codes are not getting any payments from the insurance. So we can go for adjustment. Example, that was updated in our update tracker. At the time, you should have to take actions like adjust the that remaining CPT. So in that way, we would like to take actions accordingly. So, but for example, if you like to adjust the claims at the time, definitely you should have to verify your process updates. So before taking any action, you should have to take your supervisor assistance or your process updates. But majorly 90% the process, the actions are nothing but appeal or reprocess the claims, or also we can go for adjust the claims if we have any updates. So this is about end actions on a CO 256 denial in medical billing. Guys, if you felt our content is useful to you, could you please like our video so that it will reach as many more needy people who are looking this kind of content. And again, thank you so much for your time. Have a good health. Bye for now.